Hey everyone! We've all done it, reached for a pill or some syrup without even thinking about it. But have you ever just stopped and wondered about the incredible science packed into that tiny tablet? How does it go from a raw chemical powder to something so perfectly designed? Well, it's a pretty amazing story. So let's pull back the curtain and see how it all happens. So let me just ask you this straight up. When you look at a pill, what are you really looking at? Do you think it's just 100% pure drug? Well, the answer is a definite no, and it's going to open up this whole hidden world of pharmaceutical science that is just fascinating.
Okay, so here's the fundamental problem scientists are up against. Most raw drug substances are insanely potent. I mean, we're talking about a dose so small you'd have no way of measuring it accurately in your kitchen. Plus, a lot of them are unstable, and frankly, they can taste awful. You just can't take a pinch of the raw stuff and call it a day. It would be unsafe and probably wouldn't even work right.
To get around all this, they create what's officially called a dosage form. Now, that's just the technical term for the pill, the capsule, the syrup, the thing you actually take. Think of it like a high-tech delivery vehicle. It's this carefully engineered package that mixes the active drug with a bunch of other non-medical ingredients, called excipients, that make the medicine do what it's supposed to do. And wow, when you put them side by side like this, the difference is just night and day, isn't it? On one side, you've got this raw, unpredictable powder, but after formulation science works its magic, you get a final product that's safe, stable, and actually easy for anyone to take. It's not just a small change, it's a complete transformation.
So how do they pull this off? Well, it all starts with a super deep investigation into the drug itself. This whole phase is called preformulation. You can think of it like creating a detailed personality profile for a drug molecule, long before it ever gets close to becoming a pill.
Scientists basically become detectives. They study every little physical detail. Things like how big the particles are, what shape its crystals are, how well it dissolves, its melting point. All these little clues are absolutely critical for predicting how the drug is going to behave, not just in the lab, but more importantly, inside your body. Let's just take particle size, for example. Think about putting sugar in your tea. A big sugar cube takes forever to dissolve, right? But powdered sugar? Poof! It's gone almost instantly. It works the exact same way with medicine. By grinding a drug down into microscopic particles, you dramatically increase its surface area, which means it can dissolve and get absorbed into your system much, much faster.
And this leads to a really cool concept called polymorphism. This is the idea that the exact same chemical can pack itself into different crystal shapes. And get this, those different shapes have totally different properties. The classic example is carbon. It can form the soft graphite in your pencil or a super hard diamond. So you can see why scientists have to pick the absolute perfect crystal form. And here's a pro tip they always use. The non-crystalline or amorphous form is always the most soluble one.
Okay, so once scientists get a handle on the drug's physical nature, they run into the next massive hurdle, making sure it doesn't spoil. Yep, that's right. Medicines have a shelf life, and a huge part of the job is this constant battle to stop them from breaking down over time. So what are we protecting it from? What are the biggest villains lurking in your medicine cabinet, just waiting to ruin your medicine before you even get a chance to take it? Well, it pretty much boils down to two things you know very well: water and oxygen. Hydrolysis is basically a chemical attack by water molecules, and oxidation is an attack by oxygen. It's the same reason an apple slice turns brown, or a piece of metal starts to rust. Your medicine is literally under attack by the environment around it. But don't worry, formulators have a whole bag of tricks to fight back. For instance, they add antioxidants. These are like little hero molecules that sacrifice themselves to any stray oxygen, protecting the actual drug. They can also add things called chelating agents that trap tiny metal impurities that might speed up decay. Everything from chemical buffers inside the pill to the light-blocking bottle it comes in is designed to keep that medicine safe and stable. So we've talked a lot about the active drug, but what about all the other stuff inside that pill? Well, this is where we enter the world of excipients. They really are the unsung heroes of your medicine. And check this out. This is the part that blows most people's minds. In a lot of pills, the active drug you actually need might be just a tiny fraction of the whole thing. The rest of it, sometimes over 90%, is made up of these excipients. They're the fillers that give the pill its size, the binders that keep it from crumbling, and a whole lot more. I love this analogy. If the active drug is the star of the movie, then the excipients are the entire supporting cast, the crew, the director, the whole shebang. They're holding it all together, making it easy to swallow, maybe adding some color, and keeping it fresh. Without them, the star just couldn't do their job.
All right, at the end of the day, all of this amazing science has to pass one final, super important test, the human test. Because what good is a medicine if a patient just won't or can't take it? And this is a huge deal, especially when you're making medicine for kids.
And that brings us to a really important point. Things like the color, the smell, and especially the taste, they aren't just for show. They are absolutely fundamental to making sure someone actually takes their medicine as prescribed. I mean, the most effective drug in the world does absolutely nothing if it's just sitting in the bottle because it tastes horrible.
And of course, they've got this down to a science. There's a whole playbook for it. For example, if a drug is really bitter, a flavor like cocoa can help mask that. If it's sour, you might go with a fruit or citrus flavor. Got something salty? Maybe a little cinnamon or raspberry will do the trick. It's all incredibly thoughtful, all designed to make the experience just a little bit better. So, from a molecule's perfect crystal shape to just the right amount of raspberry flavoring, the journey from a simple powder to a finished pill is this incredible, hidden masterpiece of science. So the next time you open that medicine bottle, maybe you'll see more than just a pill. Maybe you'll see a tiny, brilliant piece of engineering.